Did you know that Alzheimer's disease can start developing years before obvious symptoms appear? Most people don't recognize the early warning signs until it's too late. In this video, we're revealing 7 early signs of Alzheimer's disease that you should never ignore. Some of these may seem harmless at first, but they could be red flags of something more serious. The sooner you spot them, the better the chances of slowing down the disease. Stay with us until the end, because sign number 7 might surprise you. 1. Memory loss that disrupts daily life. One of the most common and earliest signs of Alzheimer's disease is memory loss. However, not all forgetfulness is a sign of Alzheimer's. We all experience moments of forgetfulness, especially as we age. What differentiates Alzheimer's-related memory loss is the severity and impact on daily life. Individuals with Alzheimer's may frequently forget recently learned information, ask the same questions repeatedly, or rely heavily on memory aids like notes or electronic devices. For example, they may forget important appointments, events, or even the names of close family members. Over time, this memory loss becomes more noticeable and persistent. In the early stages, individuals may also misplace items, like car keys or glasses, and struggle to retrace their steps to find them. When these memory lapses begin to interfere with work, social interactions, or routine tasks, they should not be ignored. The reason memory loss occurs in Alzheimer's disease is due to the progressive damage to the brain's hippocampus, a region responsible for storing and recalling memories. As Alzheimer's progresses, it continues to damage this area, making it harder to form new memories and retain old ones. It is important to understand that while forgetting an occasional name or appointment might not be alarming, significant memory loss that hinders everyday activities warrants attention and evaluation by a healthcare professional. 2. Difficulty planning or solving problems. Another early sign of Alzheimer's disease involves changes in the ability to plan, organize, or solve problems. This can manifest in various ways, such as difficulty following a familiar recipe, managing finances, or keeping track of bills. Someone in the early stages of Alzheimer's might struggle to concentrate on complex tasks that require logical reasoning, such as balancing a checkbook, solving a math problem, or even planning a simple event. Tasks that were once easy and routine may begin to feel overwhelming or confusing. This impairment occurs because Alzheimer's disease disrupts the brain's ability to process information and make decisions. The disease affects regions of the brain involved in executive functioning, such as the prefrontal cortex, which controls reasoning, judgment, and planning. As a result, people with Alzheimer's may experience difficulty with organizing thoughts or managing tasks that require step-by-step instructions. In the early stages, these difficulties might be subtle, but over time, they become more pronounced and might interfere with the ability to function independently. 3. Confusion with time or place. People with Alzheimer's often experience confusion regarding time and place. They may forget the date, the time of day, or the season, which can lead to disorientation. For example, a person may become confused about whether it's morning or evening, or they may forget where they are or how they arrived at a certain location. In some cases, they may get lost in familiar places, like their neighborhood or local store, and have trouble retracing their steps to get home. This sign is particularly concerning because it can lead to dangerous situations, such as wandering or being unable to find their way back home. Additionally, disorientation can make it difficult for individuals to keep track of appointments, responsibilities, or even personal care routines. The confusion typically arises from the damage caused by Alzheimer's to the brain's temporal and parietal lobes, which are responsible for processing time, spatial awareness, and orientation. Family members and caregivers should be alert to changes in how a person with Alzheimer's perceives time and place. If the individual starts exhibiting increased disorientation or becomes easily confused about where they are or when events are taking place, it is important to consult a healthcare provider. For trouble understanding visual images and spatial relationships, vision problems are often overlooked in the context of Alzheimer's disease, but they can be an early warning sign of cognitive decline. People with Alzheimer's may have difficulty with visual perception, including problems with depth perception, judging distances, and recognizing familiar faces or objects. For instance, they might have trouble reading, judging distances while driving, or recognizing people they know well. They may also experience issues with distinguishing between colors or have difficulty understanding spatial relationships between objects, such as how a fork and knife are used at the dinner table. This sign of Alzheimer's disease is linked to damage in the brain's occipital lobe and other regions that are involved in visual processing. As the disease progresses, the individual's ability to interpret visual stimuli becomes impaired, leading to confusion and difficulty navigating the environment. In severe cases, they might not recognize faces of loved ones or fail to comprehend the layout of their home. Because visual and spatial problems can sometimes be mistaken for issues related to poor eyesight or other health conditions, it is important to have a thorough evaluation to rule out other causes. If these symptoms persist and interfere with the person's daily life, they should be taken seriously and brought to the attention of a medical professional. 5. Withdrawal from work or social activities. A common but often overlooked sign of Alzheimer's disease is social withdrawal. People with the disease may start to withdraw from activities they once enjoyed, such as hobbies, social gatherings, and even regular interactions with friends and family. They might become increasingly reluctant to engage in conversations, avoid social events, or isolate themselves from loved ones. This withdrawal can be a result of frustration or embarrassment due to memory problems, confusion, or difficulty keeping up with conversations. They may also feel anxious about their inability to follow discussions or participate in group activities. In the early stages of Alzheimer's, individuals may also experience mood swings, depression, and anxiety, which can contribute to their withdrawal from social interactions. As cognitive function declines, they may begin to feel more self-conscious about their symptoms, leading to further isolation. Additionally, some individuals may have difficulty initiating or maintaining conversations, which can make socializing more challenging. 6. Changes in mood and personality. Mood and personality changes can be one of the more subtle, yet significant, early signs of Alzheimer's disease. Individuals who were once calm, composed, and generally stable may begin to exhibit increased irritability, anxiety, depression, or mood swings. These changes can manifest in different ways, such as feeling easily upset, confused, or fearful in unfamiliar situations. A person who was once outgoing may become suspicious or mistrustful of others, while someone who was typically joyful may start to feel sad or hopeless for no apparent reason. As Alzheimer's disease progresses, the emotional and psychological effects can become more pronounced. Individuals may experience significant shifts in how they express emotions or respond to situations. For instance, they might react more intensely than usual to minor events or become withdrawn and disinterested in activities they once enjoyed. Some people might also show signs of aggression or agitation, which can be especially challenging for family members and caregivers. The root of these changes lies in the damage caused by Alzheimer's to the brain regions responsible for regulating emotions, such as the amygdala and prefrontal cortex. 7. Impaired communication skills. A less commonly discussed, but highly significant, sign of Alzheimer's disease is difficulty with communication. In the early stages, people with Alzheimer's may start to experience problems with finding the right words during conversations or may struggle to follow or join in discussions. They might repeat themselves frequently, forget simple words, or use vague terms like thing or stuff instead of naming specific objects or concepts. This difficulty can lead to frustration, especially for individuals who previously had strong communication skills. As the disease progresses, it can become increasingly difficult for a person to understand spoken or written language. They may lose the ability to follow complex instructions or become easily confused during conversations. In the later stages, people with Alzheimer's may struggle with speaking coherently, and may even stop speaking altogether. This decline in communication can lead to feelings of isolation and stress, both for the individual and their family members.